think there's a number of reasons that GPs would want to come to the area. We have a system in Wales which allows us to link together in a much more coherent way how primary and secondary care work together. That's largely because we have very rural communities, and we have a system whereby the hospitals and primary care are all under the auspices of a single organisation. For a GP coming into the area, that means a number of things. One is that you feel much more part of a single organisation, and we work very closely with primary care at the health board level. But also it gives you opportunities to have different careers in primary care than you would perhaps get in a big city.
One of the interesting things that I've been allowed to do by the practice over the years is develop a portfolio interest in a number of areas. I worked as an educationalist for 20 years for Cardiff University. I've been involved in educating GPs at postgraduate level for some time. You do some undergraduate teaching. I've also become a lecturer in diabetes for Warwick University. So although you live in this area, there are a number of opportunities to do other things.
But in South West Wales, we have a network of excellent training practices. They are remarkably welcoming and friendly, very supportive to young doctors in training. And it's interesting, the feedback that we've had consistently over the last few years from trainees who've gone through have been really, really positive.
The training here for trainee GPs is, I would say, exceptional. I came through it only a few years ago. We meet every week, and that's all the registrars, so from year 1 to year 3. We get to do teaching on various subjects. We also do trips every term, so that's not only good for educational value but also getting to know your fellow trainees, so there's a good cohort there. And the training and those meetings don't end with us in this area. We have a first 5 group, which means that your first 5 years post-training, we all meet up once a month. We have sessions on things that we feel are important for us, so learning points that we've picked up. And it's also great to build a relationship with other young GPs in the area.
I think there's an opportunity for these people to come in and work with established practices so that in 3 or 4 years' time, when my cohort leaves and retires, then they'll actually have quite a high degree of autonomy in that they'll be able to run the practice, they'll be confident in terms of the business or the practice, and then they'll be able to set their agenda, their new ways of working, and that opportunity won't come very often.
I'm deeply passionate about the NHS. I think it's one of those very civilising things that human beings have come up with. It's there for when someone asks for help and another human being can give that help. I think the way that you deliver great care and great experience for our patients is by investing in our staff, by ensuring that our staff are able to do their jobs to the best of their ability. So some of the things that we can offer within our health board is the ability to link to universities. We are a university health board, so we have some great and developing links which will allow clinicians who are ambitious around research, around innovation, to be able to work with those universities to take that forward. And that's something I would really wish to support, because I think for me, having a workforce that is able to do some of those things ultimately benefits our patients, because it's about how we deliver new care in different ways.